ADHD is, as described in the initials, Attention Deficit Hyperactivity Disorder. I think this causes some confusion to people because of the presence of the H, the hyperactivity. Because there are at least two variants of ADHD. There is ADHD inattentive type and ADHD hyperactive type. So inattentive type is actually sometimes called ADD, Attention Deficit Disorder, and often it presents with little or no hyperactivity. And in fairness, this is more commonly the presentation in adulthood, where individuals present with chronic problems of concentration, focus and attention, rather than gross hyperactivity. The second thing to say about ADHD generally is it's very much a brain condition. It's a neurodevelopmental condition which starts at birth and affects the way that the brain develops. There are structural changes that can be demonstrated within the brain, and also functional changes, by which I mean the brain doesn't work in quite the same way as in a normal individual. The particular areas of the brain which are affected is quite complicated, and I don't think anybody fully understands exactly how it works. But the key areas which seem to have problems are the frontal part of the brain, the basal ganglia or corpus striatum, and to a lesser extent the temporal and cerebellar lobes of the brain, which do not function in the right sort of balance. Brain activity is mediated via nerves, and they pass messages through the release of chemicals in tiny amounts from nerve endings. And the chief chemicals which seem to be implicated in ADHD, as opposed to mood disorders, which is more associated with abnormalities of serotonin, the key chemicals are dopamine, which is very important, noradrenaline, which is important but less so, and to a much lesser extent a chemical called glutamate. The manner in which and the amount of these chemicals which are released in the brain drastically affect attention, concentration and focus. And individuals with abnormalities of dopamine function, for example, often live in something of a fog. They find it very difficult to concentrate. They're constantly distractible. They cannot set down to task, and they simply procrastinate and do not start a task or feel overwhelmed by their experiences. From my point of view, it's very interesting that in ADHD there is a state of mind which individuals get into, which is sometimes called the default setting. There's actually a default area in the brain, which the best way to understand this is it's very much like a screensaver mode on a computer. And it's as if a person with ADHD is working with a computer, and when they're working on a Word document, it keeps going to screensaver mode. It keeps switching off. Now, there's actually an area of the brain which becomes active during this screensaver mode, and the relatively low levels of dopamine allow this to happen more frequently. So it's extremely difficult for individuals to remain on task without daydreaming.